Dr. Jason Collier, and welcome to another one of our video blogs. And I wanted to take you through another case. This is a patient that presented to our care having been under treatment with another dental specialist and happened to have a number of complications. And she decided she wanted to work with a doctor and team that was a bit more experienced and focused on dental implant treatment and dental implant restorations. So she came to us and we sat down and discussed some of her concerns and addressed some of the things that we saw as well. And if, as one of the things you might be able to see that's maybe a little bit more obvious, is she had some pretty yellow teeth that she was unhappy about. We can also see that she was showing a lot of the gummy tissue in the back of her mouth, what we call a gummy posterior corridor. And she also had an inadequate smile or an unfilled smile. So if you were to look at her mouth, she had a lot of dark space in the back of her mouth that we wanted to fill with a nice, pretty smile. In her x-ray, she presented to us with one implant that had already failed, which was one of the complications that she had, and then with another implant that was failing, that needed to be removed. One of the other things that we saw was she had a resorbing, what we call posterior mandible. So the back of her jawbone was resorbing, and this was due to wearing a removable partial for a long period of time throughout her life, and those kind of things cause a bit of resorption in the back of the mouth. It's pretty common, and it resorbed so much that she did not have adequate bone for placement of implants in the back. So we discussed what some of her options were, because one of the things we want to do is prevent any more of that resorption in the back. So one option is we could do a fixed hybrid prosthesis. That was one option that was on the table for her. We could also do an implant retained removable prosthesis. That was one option. Or we could do an implant. We could place implants and then with a connector bar that connects those implants with a part that extends off the back to give support for that posterior, that back of the mandible, along with a removable prosthesis that snaps on to the connector bar. And that is the option that she chose. We felt like that was actually the best treatment in her situation. So this is the day of surgery where we have implants in place. We did do some grafting to restore the bone where she had some infection and some bone loss. So we did the grafting. We placed implants in place and allowed that to heal 12 to 16 weeks, which is the amount of time that we generally allow implants to heal before moving forward with the prosthetic phase of treatment. And then here she is with her a screw retained bar, like we discussed. As you can see, that bar does extend off of the back to give support and prevent any more bone loss in the back of her mouth. I see so many people who have been wearing removable type prostheses for a long period of time, and you can get to a place where you have very, very little bone and run the risk of fracturing your jawbone. So we wanted to prevent that in her case, and that's what we were able to do with this type restoration. So she has the screw retained connector bar in place, extending off of the back to give support for her removable prosthesis. And this is her with the prosthesis in place. So as you can see, we also addressed the cosmetic concern to have a much wider smile. We've eliminated that gummy smile, and we also have a proper smile extension. So she has her mouth her smile is filled with nice, beautiful teeth, so that she's happy to smile once again. So here we are with her as she presented to her office in the beginning, and here she is with her final restoration. I hope this case has been helpful for you in recommending treatment for patients that you might see with the resorbed posterior mandible, which is something that we see quite often. I believe the connector bar with posterior extension is in my opinion, is one of the ideal ways to restore these patients back to health, back to proper function, back to comfort, and as well as to a nice cosmetic result. So again, I hope this was helpful. If you have any questions or comments, please feel free to give us a call. at Southern Dental Implant Center. Again, this is Dr. Jason Collier. Thank you for